And with that, I yield to our ranking member, Congressman Cole.
Thank you very much, Madam Chair. Let me begin with a little housekeeping, if I may. I've, as you know, served as the ranking member on the Rules Committee, as well as on the Subcommittee on Appropriations. And in an hour, we start a hearing on war powers, which I know people are very interested in. So I will not be with you for the entire hearing. I regret that very much, but I just have to discharge my duties. But let me begin by wishing you again good morning. To you, Madam Chair, to members of the subcommittee, and to our testifying witnesses. I want to commend the Chair for holding yet another hearing on an important issue, one that touches us all. Today, we're here to learn about programs that seek to improve maternal and child health. Unfortunately, for far too many, the United States is not the shining example that it should be in this area. I hope with investments we continue to make to expand access to service and create change for expectant mothers in the health system, we can reverse course and lead the world in quality care for all mothers and children. I want to recognize as a leader on this issue and a proud member of this subcommittee, Ms. Herrera Butler. She sponsored and got signed into law the Preventing Maternal Deaths Act of 2018. In addition to this work, she launched the Congressional Caucus on Maternity Care with Congressman Paul Allard, another leader in this area. And I want to thank both of these offices for helping to prepare for this day. And I'd be remiss not to mention the decades of congressional leadership by the chair of efforts to improve the health and welfare of children. Chair DeLaura has spent much of her congressional career seeking to improve the lives of children and has been a longtime chair of the Congressional Baby Caucus. Our subcommittee membership has led Congress in legislative efforts and still continues this work with several proposals to advance newborn health screening and address the unique needs of moms in rural areas. The United States has one of the highest maternal mortality and infant mortality rates of all Western nations, a fact that's simply unacceptable. My own state of Oklahoma ranks as the fourth highest state in the entire country for both maternal mortality and infant mortality. It's an imperative that we do better. To address these problems, our subcommittee has made several significant investments to improve maternal health and address disparities in maternal mortality. We've increased resources to all 50 states and territories through the Maternal and Child Health Block Grant flexible funding that supports a range of health services for moms and babies. We've worked to establish maternal mortality review committees, multidisciplinary teams that comprehensively review deaths of women during or within a year of pregnancy. And I know in the coming year, we will do even more to support these programs. The leadership represented by this subcommittee in the area of today's hearing shows how important the topic is today and how fortunate this committee is to have such experts and champions making critical funding decisions on these programs for moms and their children. We all know the new virtual environment can pose an untold number of technical challenges. I want to acknowledge the work of the chair and her staff, particularly Tricia, and I know I'll butcher your name, Tricia, so I'm sorry, Castindi, for making these virtual as seamless as possible. I know a lot of hard work goes into that happen, and I certainly appreciate those efforts. And I want to thank all our witnesses for coming before us today, sharing their time and expertise. We are always grateful to have you. And thank you again, Madam Chair, for holding this hearing. It's a very important one as we go about our work for this session of Congress. I yield back the balance of my time.